Hey, healthcare workers. Do you feel like you aren't being seen or heard, especially at work? You aren't alone. This has become a huge problem in healthcare. We speak about the injustices in healthcare today, yet it's as if no one hears us. We try to speak out against the injustices to our patients, our colleagues, even ourselves. And it's like we're speaking to air. Our words fall on deaf ears. It's almost as if it's like we're speaking the wrong language, or if there's some sort of secret code or secret password and nobody's told us what it is. It's like we can't get across to the decision makers, even to go about our job in a safe manner, even just to try to save our patients' lives. Do you know what I mean? Do you understand what it is that I'm trying to say here? Or even worse than not being heard is that we'll be heard and there will be retaliation. What the heck? I'm just so tired of it. I'm so tired of having this happen to me, having this happen to my friends. All we're trying to do is just take care of our patients. And I felt this way for years. I felt as if other people knew some sort of secret code for speaking with the nurses, speaking with the subspecialists, speaking with the administrators. And I was somehow left out of that class in medical school. Eventually, I got better at speaking with the nursing staff and better at speaking with the other physicians. But talking to administrators still makes me uncomfortable. It's like going to the principal's office. And each time I go, it fills me with dread. I I go, but I certainly don't feel good about it. And when the conversation's over, I feel like an hour later or that night or the next day, I feel like there's certain things that I should have said or could have said better. And it makes me feel like a bad physician, or at least like I'm not the leader in medicine that I know I can be. And I know I'm not alone. I know there are those of you out there who have felt the exact same way. And what ends up is that I feel like I'm not protecting my team or my patients the way that I should. I'm not being the advocate that I know that I can be. And what happens is that I sometimes end up bringing fire and brimstone down on my team or my patients or even my own head when all I'm trying to do is make sure that safety guidelines get followed. Published guidelines. Accepted guidelines. Come on, you guys, this isn't hard. It's not rocket science, and it just leaves me shaking my head. And sometimes it's just as bad when I'm talking to my colleagues. Have you ever had difficulty negotiating for an equitable call schedule or an equitable holiday schedule? Sometimes you get a warm, sunny, honorable person in charge of these schedules. Somebody who actually cares about being fair to everyone involved. Someone like my niece, who is currently going through her anesthesia residency, and she truly cares about being fair to everyone on that schedule. And I see how she struggles with this. Other times, you get a dungeon master, someone who will literally troll the people on the schedule that he or she does not like and intentionally gives them a worse schedule over and over again. And the people who are favored know it's not fair, but either don't care enough to speak out, or aren't brave enough to speak out, or don't feel strong enough to speak out against the inequity that they know is happening. This is someone that you know needs an instant infusion of emotional intelligence. You wish emotional intelligence worked that way. The truth is that emotional intelligence can be learned and that there is a secret code. It's what I call a bank code. It's that secret code of knowing someone's core values, the core values of your coworkers, your administrators, and those other people that you find difficult in your work life. And there's a secret way of actively listening for their core values or their bank code. And it allows you to be better at negotiating, better at setting boundaries, and at raising your emotional intelligence. That's right, I said your emotional intelligence. You see, you can't force someone else to raise their emotional intelligence, but if you raise your emotional intelligence, then it helps you to manage your emotions and the emotions of the people around you. It helps you to manage their emotions, which is so incredibly useful. So that's part of the secret. That's the system. And you can bring all kinds of arguments up about how that's not going to work. But the truth is that it does. And I know it works because I have used this. I have used this to deal with bullying. I've used it to deal with retaliation. I've used it to deal with entire systems who are encouraging bullying. And I've done this firsthand, and I've done it for people who've come to me for coaching. And now I'm using this to raise up an army of healthcare workers who will no longer put up with this status quo of bullying and burnout in healthcare. So if you're fed up with the incivility, join me. If you're fed up with the overwhelm and the lack of support, then join me. If you're ready to become a part of the solution, then join me. If you want more information, then email me at drnan@beatdownburnout.com and become a part of this army of people, this army of healthcare workers. You don't have to be a physician. You don't have to be a nurse. You just have to be any part of healthcare worker anywhere in healthcare. And join me. I'm Nanette Nessel, MD, and I'm here to help. Together, we can do this. I'm Nan Nessel of Beat Down Burnout, and as I said, I'm here to help.